In this video, we're going to cover key things that you need to know about recognizing and managing an infected nipple piercing. So first of all, how do you recognize it? Well, if a nipple piercing becomes infected, several signs may indicate a problem. The most common symptoms and signs include persistent redness, swelling, and pain at the piercing site beyond the initial healing period. The area might also feel very warm to touch, and there could be a discharge of pus, which might be a green or yellow liquid discharge, which often has an unpleasant smell to it. Now, the skin around the piercing might also become increasingly painful, and you could experience a fever, meaning a temperature greater than 38 degrees C or 100.4 degrees Fahrenheit, and generally being unwell, which are signs that the infection might be spreading. Now, I do want to point out that an infected nipple piercing is different from an irritated nipple piercing. Now, whilst an irritated piercing might look red and might be slightly sensitive to touch, that will usually settle down by itself, and you wouldn't usually have the extreme redness, fever, or say discharge of pus that you would see in an infection. In terms of what causes an infected nipple piercing, well, there are lots of different reasons, but it's typically caused by frequently touching the piercing site, so it's really important to try avoid doing this. That's because bacteria can get introduced to the area around the piercing, which can increase your risk for an infection. And similarly, exposing your piercing to saliva or other bodily fluids might also cause infection. Now, obviously, the best thing to do is to try and prevent an infection in the first place, and this starts with proper piercing hygiene from the very beginning. So, with this in mind, it's really important that you get your nipple piercing done by a professional who uses sterile equipment. Now, after getting pierced, it's essential to follow the aftercare instructions that should be provided by your piercer. Now, this typically includes cleaning the area with a saline solution twice a day, and you can normally do this by boiling some water, letting it cool down, and adding a tablespoon of salt to it, as well as avoiding touching the piercing with unwashed hands and avoiding water that might contain bacteria, so things like pools, hot tubs, or lakes for the first week or so after getting your nipple pierced. And it's also really important to avoid wearing tight clothing that might irritate the piercing, and instead it's better to wear loose, breathable fabrics during the healing process. Now, if you do get an infection, it's really important to address it quickly. So first begin by washing your hands with warm water and soap and continuing to clean the area gently with a salt solution. Now, it's really important not to over clean, which can irritate the skin further, and I'd suggest that you avoid using alcohol, hydrogen peroxide, or ointments like Neosporin, and that's because these can damage the healing skin as well as the underlying tissue or trap bacteria in the wound. Next, you might be able to improve drainage of the infection by applying a warm compress to the nipple, and you could try doing this for several minutes 2 to 3 times a day. Afterwards, you should gently clean, wash, and dry the piercing area. Now, if the infection seems mild and localized, then these measures at home might be enough to help. But if the symptoms persist or they worsen after a day or two, then it is important to seek medical attention from your health provider. They might prescribe you some antibiotics to help clear up the infection, which are usually tablets, and if they do this, then it's really important that you complete the full course of antibiotics and you don't stop after a day or two if you start to feel better. It's also important not to remove the jewellery or piercing on your own if you suspect an infection, because this can trap the bacteria inside the piercing. Instead, let a professional determine whether or not the jewellery needs to be removed or changed. Finally, if you do notice signs or symptoms of an infected nipple piercing, then it is really important that you don't pinch, poke, or cut the area yourself in an attempt to drain an infection.